Throughout history, scientists and researchers have studied ways to eradicate and prevent disease, much of it through the development of vaccinations. We no longer worry about polio and smallpox, mumps and measles. Vaccinations have improved our quality of life, yet many still don't understand what vaccinations they need at various stages of life. Welcome to our USC College of Pharmacy podcast. I'm your host, Margaret Gregory. As August is National Immunization Awareness Month, we wanted to gain more insight into the significance of vaccinations. So we asked Dr. Tessa Hastings, Assistant Professor in the Clinical Pharmacy and Outcome Sciences Department, to share more with us. Dr. Hastings' research focuses on reducing health disparities and increasing access to care in underserved and vulnerable populations, especially in relation to immunizations. Hastings has been recognized by the University of South Carolina as a breakthrough star and has received the Emerging Researcher Award. She is a fellow of the HIV, Infectious Disease, and Global Health Implementation Research Institute and a Health Disparities Research Institute scholar. We asked Dr. Hastings to explain why vaccines are so important.
They're crucial for really preventing the spread of infectious diseases. They stimulate our immune system to kind of recognize and fight off different pathogens, protect us from potentially really severe illnesses and complications. And vaccines are not only important for our own health as individuals, but also in contributing to community immunity or herd immunity.
Community immunity, also known as herd immunity, occurs when a large portion of a community becomes immune to a disease. The spread of a disease from person to person is more unlikely when herd immunity is achieved. As a result, the entire community becomes protected, not just those who are immune. That is especially vital for more vulnerable populations.
It's so important because our babies aren't fully vaccinated themselves, so they're relying on us to protect them, to circle them with protection and keep them from getting those diseases or maybe reducing the severity.
Older adults should also be aware of the vaccines that are important to keep them protected.
Older adults should really prioritize vaccines like influenza, pneumococcal, shingles, Tdap, and of course the COVID-19 vaccine. And then really consider talking with their healthcare providers about any other vaccines that they may need, and that would be kind of based on their individual circumstances.
Having a primary health care provider that you can rely on for regular checkups for you and your family is critical, and having frank conversations with that provider is just as important.
It is really important for older adults to have, and really anyone, but especially older adults, to have open and regular conversations with their healthcare providers about vaccinations. Healthcare providers can assess individual needs, they'll consider specific health conditions, risk factors, and provide personalized recommendations that could include vaccines like the measles, mumps, and rubella, or MMR vaccine, or hepatitis B vaccine, depending on your individual circumstances.
Dr. Hastings explains that RSV has become more prevalent this year. There are 2 new RSV vaccines expected to be available this fall that adults 60 years of age and older can receive.
RSV is a pretty common virus that causes infections in the lungs and the airway. For most adults and healthy kids, it's usually pretty mild, and the symptoms are kind of like you would see with a common cold: congestion, fever, cough, runny nose, things like that. But it can be really serious for infants and young children, older adults, people with weakened immune systems, and other risk factors. But somewhere between 58,000 to 80,000 kids younger than age 5 are hospitalized with RSV in the U.S. each year, which can be really scary when you're thinking about your own little loved ones. Vaccinating older adults could help provide some protection to young kids too. When we talked about that community or herd immunity, everyone wants a chance to love on that newborn, and vaccinated grandparents can help prevent exposure or lessen the severity of RSV to that little one, when the impact of RSV on older adults has often been underestimated, and there's somewhere between 60,000 to 160,000 hospitalizations among older adults in the U.S. each year due to RSV.
In many places, especially rural areas where there are often fewer healthcare providers, access to healthcare can be of great concern. Hastings stresses that for many vaccines, patients don't have to see a physician. Pharmacists are among the most available providers of reliable healthcare information in many communities.
Pharmacists play a really important, a vital role in vaccine administration, something that has become quite apparent the last few years with COVID-19 especially. So more than 300 million doses of COVID-19 vaccine were administered in community pharmacies through that federal program alone. Overall, more doses were administered by pharmacy team members than all other health professionals. Pharmacists are trusted, reliable, highly trained, accessible healthcare professionals that can help you make those vaccine decisions and administer the vaccines that you do need right there in the pharmacy, a convenient setting, especially for those people who might be in rural or underserved areas.
Much of Dr. Hastings' research focuses not only on the need for vaccines, but also on access to immunizations and also on how to keep track of immunizations, especially in rural and underserved areas.
My research primarily focuses on implementing evidence-based interventions in community pharmacies to improve vaccine access, especially in rural and underserved communities. Some of this has involved identifying barriers and facilitators to implementing different vaccines. So, for example, human papillomavirus or HPV vaccination services in community pharmacies, from looking at what those barriers and facilitators are from both the pharmacist and the parent perspectives, and working with pharmacists and other healthcare professionals to develop creative solutions to increase referrals to pharmacies for the HPV vaccine and overcome some of those other barriers.
As part of her research, Hastings examines the barriers that pharmacists may face in providing vaccines to their patients and ways to help resolve those issues. Those include issues such as the availability to keep enough of a particular vaccine on hand and determining the best ways to talk with a patient about their particular needs, especially if a patient may be reluctant to get a vaccine. That is why knowledge and education around any particular vaccine is vital, and pharmacists can help educate their patients.
Pharmacists are working really hard to overcome it and correct and talk with their patients to help them better understand that or answer any questions that they might have. And pharmacists are really good at that. They're trusted healthcare professionals. They have relationships with their patients, and their patients trust them and what they would recommend. So they're a really great resource when it comes to addressing vaccine hesitancy and improving vaccination rates, especially in the rural communities. They're the go-to place for healthcare.
Such systems are a critical tool for maintaining accurate immunization records and making it easier for healthcare providers to identify appropriate vaccines and who may or may not be receiving which vaccine.
When you start thinking about all the different places you could go to receive a vaccine, you might get one at your pharmacy, you might get one at your primary care provider or a different pharmacy. That's fantastic for increasing access, which we know is an issue. However, the caveat is that without a way to consolidate all the information, your record becomes really fragmented. So it's difficult for you as a patient to access a complete immunization history when you need it. You need one place where you can go to get your immunization history. So immunization information systems, or IIS, help to address this concern of fragmented records by consolidating administered vaccine information from immunizers within a defined geographic area. We're able to provide those recommendations when they're needed, so we're not missing opportunities, but then you're also not over-vaccinating. You know what you got and what you need, but someone else might not be as up to date and could be a concern.
Dr. Hastings' work would not be possible without the support she receives from outside funding sources and research dollars.
We have been very lucky to have received some funding to support the research that we're doing from various organizations, and this is really critical to the work that we're currently doing. Pharmacists are so innovative, and we've taken away some really, really great best practices to kind of tailor implementation strategies that will be evaluated in a smaller feasibility test before we apply for additional grant funding to hopefully scale this approach to reach more pharmacies across South Carolina and potentially other states as well.
South Carolina is lagging behind many other states in relation to vaccination rates. In 2019, only 59.1% of children ages 5 through 12 in South Carolina received the flu shot, while just 50% of teens ages 13 to 17 in the state were immunized against the flu. The pandemic also did not help, as parents pushed back well-care visits for their children, resulting in a dramatic drop in vaccination rates.
There's quite a few vaccines where South Carolina could be doing much better when it comes to vaccination rates. A few years ago, we were among the lowest in the nation for HPV. We're still very low, but we've improved a bit, so there's some good news there. But there's a lot of work to be done when it comes to vaccination rates and vaccine hesitancy, and we know that vaccination rates are lower in rural communities, and we have a very large rural community, so it's concerning. There are really great things happening though, and I think there's potential for a lot of improvement.
Again, that's where Hastings stresses that pharmacists can have a tremendous impact in increasing vaccination rates by having conversations.
Pharmacists are easily accessible. 90% of America lives within 5 miles of a pharmacy. So when you think about those rural communities and ways to improve vaccination rate, we've seen a lot of outreach and pharmacists doing so much more with immunizations because they stepped up during COVID-19 and really took on a lot of that responsibility. Even with pediatric patients, if you think about all those kids that fall through the cracks and they don't have a pediatrician, they're not getting vaccinated. Pharmacists are a really great point of contact where those kids could be reached. There's a potential there for pharmacists to make a really huge impact. I hope our discussion really inspires the listeners to be proactive about their health and not hesitate to approach their pharmacists for advice on vaccinations.
Thank you for joining us for our podcast from the College of Pharmacy. To learn more about Dr. Hastings' work, visit her profile page for faculty and staff at sc.edu/pharmacy.